Hey guys, it's Dr. Emer. It's the weekend in West Hollywood, Los Angeles, and we are having a wonderful day in the clinic. We love our Saturdays. We do it once a month to help our patients that work a lot during the week that can't come in. Also, to do some bigger procedures, and we have, you guys, we talk frequently about the use of lasers to prevent skin cancers. I posted about it this week, doing it on a person's back. We're now doing that same laser, the Fraxel, to just resurface a young guy's face, and this is something consistently he does for anti-aging, but also because he's blonde and blue, he gets sun damage very easily and is at high risk of developing skin cancer. So for preventative maintenance, he's doing really, really well. He's doing a consistent every few months Fraxel, which is what I do to keep him young and good looking, but also prevent any issues with the skin. And this also, guys that have thick skin, that have a lot of porous skin, that get a lot of acne or easy get lines and wrinkles, this will help prevent that. What the important thing I want to show you is that we also will treat the neck, because we don't just want the face. You get sun damage elsewhere as well. So we're going to turn your head all the way to the left. We're going to also treat the neck. And if you take a look right now, basically no sun damage, but typically blonde and blues patients have a red discoloration and a lot of brown that starts to form in the 20s and 30s on the neck. We call that poikiloderma. Some people call it observat because of the person that discovered it. But long story short, the treatment is anti-aging, peels, lasers, skincare products, and sun protection. If it's a lot of redness more than it is kind of the ripply look, then you would use a vascular laser, pulse dye laser, XLV yellow laser, or Airlaze. But right now, all he really needs is just resurfacing. So the Fraxel, which is our, this is the 1927, the dual, this allows us to get very superficial in the skin where sun damage is and fine lines, and get the skin to exfoliate and improve relatively quickly. It's 5 to 7 days of looking red and peely, and the first few days pretty swollen. But the overall result is really good, and he's going to have perfect complexion and hopefully no skin cancers, no sunspots. As he ages, his skin will be tighter. It's going to look a lot younger than the average person his age as he ages. So him and I, we're going to compete with each other because we do the same rotation of lasers. So we'll see who ages slower. That's the goal. Not who ages faster, who's going to age slower.
Can this be treated on African American skin?
You can use this on dark skin. My opinion would be you wouldn't want to, because there's still a little bit of a risk of hyperpigmentation. But for scars and for acne scars and traumatic scars where you need resurfacing, you can use the fractional device on a darker skin patient just with a lower density. Turn your head all the way to the right. Perfect. He's doing great. It's not the best feeling in the world, so he's doing pretty amazing. And remember, we said we always treat both the face and neck, because you want to make sure that you really address all the areas that get exposed to sun and that age. What's great about this? What'd you say?
Age spots?
Yeah, this is great for age spots, actually. This laser specifically is the #1. It's been out for many, many years, and no companies have ever been able to replicate the technology. This technology is optical scanning. So as you roll across the skin, it literally delivers the heat evenly, perfectly, every single time. Companies have tried to mirror this patent, but haven't been able to do it. That's why it's still the gold standard treatment for resurfacing, non-ablative resurfacing in the world, basically. Palomar Icon, which is a 1540, is a stamping device. It doesn't do nearly as even energy or treatment result as this. So just because something's fractional doesn't mean it's equal. Okay, you gotta go to the best. You want the best. Okay, So we're basically delivering little channels of energy into his skin, and that's going to resurface and build collagen. Your head straight for me. Perfect. Over the next, chin up all the way. Yeah, cool.
What's the post-treatment care?
What's that?
Post-treatment care?
So post-treatment, we always do an enzyme exfoliation for 3 to 5 days, vitamin C and vitamin B, and something called dermal repair cream from Sente. It's one of our favorite. We don't use anything occlusive, and we don't do anything that has a petrolatum base. What I do, you can use Resurfacing 24 karat gold oil also. That helps calm the skin, and I really like MD Rejuvena chlorophyll products because they have a lot of plant-based products that help the healing. And then the last part is you can add growth factors to speed up the healing process, which is what we want to do. Good. All right, your chin down for a second. Now, let's do a little bit more over his nose. And then we're going to switch to do a little bit of Erbium resurfacing on top.
What's that going to do?
That's going to help us exfoliate more, help the pores more, and help any superficial scars. All right, guys, stay tuned. We are doing a 2-part procedure today. We're finishing with a little bit more painful spot, but we're almost done. We're using Erbium laser very superficially to help texture and acne scars. We've already done Fraxel, which you can see on my Instagram today, my Instagram live if you go there, for just overall rejuvenation, pore reduction, and skin cancer prevention. And now we're using a fractional ablative Erbium to resurface the upper part, almost there, doing really good. And this will also help any scarring, which is, he's got previously had some scarring. And so you can see the fractional columns of the laser in the skin. Basically there. Good. Okay, we're going to do this lightly on the neck. We've already pre-treated some of the spots already. It's going to be very light.
How's this going to help after Fraxel?
This is going to help get more improvement. I'm going to take the ice pack down for 1 sec. You're basically done. Put your chin all the way up. I'm just going to do the undersurface here. Good. Yeah. This is going to help build upon the Fraxel, which went a little deeper. And this one went a little more superficial. So he's going to get 2 layers of effect. But the superficial part, which bothers him the most, is going to be the ablative. So now the last part I need to do is his lips. So we're going to do, we're going to pinch his lip in. Deep breaths, okay? Couple pulses. And we're just going to do some pulses on the lip, on the dry area of the lip, to help prevent any sun damage. And he previously had sun damage, which has basically gone away. Because he had done Michelmod treatment, but now, good. Now we just got to do the lip, upper lip, and the nose. But this is going to build upon what we've already done. Okay, hold on. Let me fix his goggle. Just got to do the nose. Make the pores shrink even more. It's just going to give him a better outcome. And this is great as a great alternative for people who don't want a CO2 but want to get like results close to it without as much downtime. You can do this. This is also good for my darker skin patients because even though he's lighter skin, you can do this on them without the risk of hyperpigmentation. Perfect. Good. And just do a little bit more back by your ear here. Good. Okay. Just doing a little bit more over a couple scars that he has. Perfect. Everything looks great. So now the last part is healing. We're going to put some stem cell and hyaluronic acid. I'm going to take this off for a sec. We're going to go ahead and put both a hyaluronic acid and a stem cell serum on him. This one is derived from adipose cell, which is a very healthy type of stem cell. You can go ahead and put those on. I'll do that in a second. You put that on.
Is my face numb enough for the microneedling?
Yeah, you'll be fine. I'm gonna do it light. I'll put a little bit of vitamin C on with the stem cell. And the needling, which we're gonna do just light enough to push in through the skin. Now he already has columns of energy that have been placed in the skin to help us, I won't go crazy, to push the stem cells into the skin, which will 1, help him heal, but 2, make his skin look better, and 3, help prevent, in my opinion, sun damage related skin cancers. It's fine. If it gets in the hairline, it's okay because it helps hair. That's what I always tell people. And we're just getting enough to push this into the skin.
What would the stem cells do?
The stem cells are mainly for healing purposes, but also to not only enhance the outcome, stimulate collagen production, but help prevention of skin cancers. So we're pushing that into the skin right now. And this is adipose derived. You can use, we also like bone marrow derived stem cells as well. Post-treatment, he's been doing this and getting really good success. So this is what we want, and then we need a mask. And then he will put some more stem cells on later tonight, 4 to 6 hours from now, hopefully. One more time with a mask. Do a little stronger of some of these scars. And now we're going to put our cooling mask on top. And this also has in it hyaluronic acid and cooling properties such as allantoin, lightening agents like Erbium, and hyaluronic acid, as well as for plumping, but as well as a biocellular matrix to help burns. Mm-hmm. So that's why I like this. I do this once a week actually with at-home rolling. I do this mask after I've rolled with needling. Perfect. And then we'll give him another ice pack for his neck. So that's really Erbium, Fraxel Erbium combination with post-therapy. But this is something you should do if you have scarring or you want preventative treatments for your skin.